Women have been giving birth for centuries, so it's a pretty natural experience, right? Wrong. I'm Stephanie King, professional doula, childbirth educator, and the creator of the My Essential Birth course, the online childbirth education course that's helping women everywhere confidently achieve their best birth. Today's culture would have us think that birth should be treated like an illness or an emergency, and that most of us need other people telling us what's best for our bodies because we aren't the experts. So sit tight, because if you're tuning into this podcast, you'll probably start to believe in your body, your intuition, and find yourself empowered and confident to do what it takes to have the birth of your dreams. If you like listening to me take you through these weekly topics step by step, then you're going to love the My Essential Birth course. Make sure that you're subscribed to the podcast, and definitely head over to myessentialbirth.com for the free downloads mentioned right here in these episodes, and to join the birth course and community full of pregnant moms just like you. I have to add a disclaimer that I am not a medical professional and I cannot provide medical advice. All of the information expressed in this podcast are based off of personal, professional, and educational experiences and are my own opinions. Please work with a provider you trust for medical advice during your pregnancy and birth. This week's reviewer of the week is Mad Stidham. And she says, at 33 weeks pregnant, I realized, holy cow, I really don't like some of the things that went down with my first labor and delivery. I started trying to find resources on natural hospital births. Enter this podcast. I started listening about a week ago. I'm almost 36 weeks at this point. I am so happy I found this podcast. It's exactly what I was looking for, and I feel more informed and excited about my birth with each listen. I'm confident that I can have the birth I want. Yay! You guys, these are the reviews I live for. So excited for you. I'm trying to look at the date. You are coming up to your due date any minute. In fact, by the time this airs, you will have had your baby. So I hope you come back and share your incredible birth story with me and all the listeners. I think that would be awesome. Okay, let's kind of get going on today's podcast. I am super excited about our guest. Her name is Lizzie Kiefer. She is a physical therapist specializing in pregnancy, postpartum, and fertility. So she's in the right place, and I'm really excited she's here. I think we often think of physical therapy or pelvic therapy as a postpartum thing, but there are some things that you can do right now during pregnancy to set you up for a better postpartum period. So Lizzie, will you take a moment and share a little about yourself?
Hi, yes, I am so excited to be here. And I have been a listener for a while, and through my pregnancy, I have just found this podcast to be such a great resource. So Yay. Very excited to be on here. It's awesome. Okay, so I am a pelvic floor physical therapist, and I initially started out as just an orthopedic general physical therapist. And I have since found my passion in women's health. And I see, like you mentioned, pregnancy, postpartum, as well as the fertility aspect, which is also near and dear to my heart. But yeah, I have my own business now. I opened in the heart of you know what? And since then, it's just been going great, and I haven't looked back. So
that's really neat. How did you get started in this specifically? Like, did it have to do with your own stuff? Has this always been a passion? Like, where did this come from?
So when I was thinking of opening up my own practice, I had already started to get more interested in women's health and pelvic floor PT, because I kept hearing, my sister, friends, everyone talking about different issues that they had after having a baby, whether that be C-section issues, obviously all the things like peeing your pants and so many things we could list. But yes, exactly. But these things I have found I can help with. I can help people with this, and there's such a need for it. And it also allowed me to look inside my body a little bit more and go deeper with my health too. So, it's just an area that I think needs more help and care, and I love doing it.
I love it. And that's the kind of person that should be doing it. So good. I'm so excited you're here.
Me too.
Yeah, Lizzie has been wonderful enough to offer all of you guys that are listening a free PDF download. It's really great. I'm going to have her talk about it at the end of the episode. And of course, you can always get it in the show notes. So it's going to go along with everything that we're talking about today. I think I have definitely done some different questioning of pelvic floor therapists, like for myself, and I've had one or two here on the podcast as well. But for those that are listening now, will you talk a little bit about what is pelvic floor therapy?
For sure. Okay. So pelvic floor physical therapy is assessment of the pelvis. So we are looking at your pelvic floor muscles. We're looking at bone structure. We're looking at different mechanics, physiology of specifically the pelvis, but also the holistic approach. So looking at joints above and below, why you might be having these issues, whether they be from the body or maybe external factors such as stress, so many different things in your life. So essentially we are doing a exam of the full body as well as an internal exam if that's something that you're open to. You do not always have to do an internal assessment. And I think that's something that people get maybe nervous about or think that pelvic floor PT is totally just all, internal work, but that's just a component of it. And it does not have to be done if you're not comfortable with that. So we're just assessing all of those muscles just like you would any other muscle of the body. And we go through exercises and lifestyle modifications, just like any other kind of physical therapy. So we're just a little more specific to pelvic floor dysfunction.
That's awesome. I will be honest, I did not hear about pelvic floor therapy until after I had all of the children that I currently have now.
Yes.
I definitely went for some tightness and some discomfort during intercourse and some losing my bladder, all of that fun stuff.
Oh, yes. Yes. But, so common. Yeah.
Yes, it is common. Yes. Thank you. Right. Like it's not just me. And I think moms need to hear that.
Oh my gosh.
It's very normal.
Yeah.
And in the normal sense of like, you don't have to live like that forever, but it's common. I should say common, not normal.
Exactly. Even myself as a pelvic floor PT, I did all the things to prepare my body. And afterwards, you have incontinence. That's just how it is. Your pelvic floor gets weak, but you can work to build that up and not have those issues. So yes, it's common, but there are things to fix it.
Yes, I love that. And with that, actually, because what I love about this is the majority of my listeners are likely pregnant. And so I don't want them to just know about it for postpartum. Like talk to me about how they can utilize that right now in pregnancy to make pregnancy and postpartum better.
Oh my gosh. Yes. There are so many things you can do during pregnancy to prepare your body for that healing period and to just keep it strong and healthy during the pregnancy. So as you go through your pregnancy, of course, there's a lot of load being put on your pelvic floor, a lot of pressure, your abdominals are being stretched, your back is, things are just changing. So what we can do is just protect our body through learning how to do proper movement. Strength training is a huge one. I teach all of my pregnant clients how to do strength training of some sort, because that will help you as you go through that pregnancy with a growing belly, and then also through labor and delivery. That is such a taxing thing for your body. So if you can train yourself through pregnancy safely, that will set you up through that delivery a lot better, as well as that healing postpartum period. So strength training, deep core work, pelvic floor strengthening, as well as relaxation, because that is huge as you lead up to labor and delivery. So yeah, those are some of the big ones that I usually talk to my clients about.
You're talking all my love languages, so I kind of love this right now. When you're saying strength training, though, are you talking about the entire body or specific to pelvic exercises?
Entire body, especially single leg movements. A lot of people have heard of pubic symphysis dysfunction, that lightning crotch kind of thing.
Yes,
that
explain
is so
that. Take
common.
a moment and explain what that is. Yes, this is huge.
Okay, so lightning crotch or pubic symphysis dysfunction is you have a joint right at your pubic symphysis. And as your body grows and as things start to shift, that pubic symphysis can become very painful with single leg movements or rolling over in bed or things like that. And it feels like legit lightning in your crotch. So by working on single leg strengthening, even double leg strengthening, mobility, that can really help prevent or decrease the exacerbation of pubic symphysis dysfunction. It's a tongue twister. Yeah. So yes, that is a huge one during pregnancy. But strength training, like I said, those single leg movements, different kind of lunges, Romanian deadlifts, things like that are absolutely important.
Awesome. I love that. Something that I know comes up for women in pregnancy, but it's also a postpartum issue. And we definitely teach in the birth course how to check for it. But I want to go over diastasis recti. I always say, I used to follow this woman and she said diastasis recti, like the whole time I followed her for all my exercise stuff. So that's how I say it. But I look at it, I'm like, but it's diastasis. I know this. Anyways. Go ahead.
Either way.
I know you can say it either way. Yes.
Yeah. So diastasis or DR, that is separation of the abdominal muscles. So your rectus abdominis, that runs from the top where your rib cage is down to your pubic bone. It's like your six-pack ab muscle. This is what really separates during birth and causes that diastasis recti. So after pregnancy, it just is really weak. And we just need to do strengthening exercises and modifications to help get that to go back together. So during pregnancy, I get asked all the time, how can I prevent this? I don't want to get a DR. What can I do? And I hate to break the news, but you most likely will get a DR during pregnancy, as I would say 99.9% of women do leading up to giving birth. So there are things you can do to help prevent the severity of it, or just to set yourself up for healing your DR postpartum. So learning how to tap into that pelvic floor and deep core, so your transverse abdominis during pregnancy, is huge. And this will help you maintain that strength during pregnancy, help with low back issues, pelvic floor dysfunction issues during pregnancy, and like I said, set you up for that postpartum healing phase.
Okay. And ways that you can do that. Are you talking about like diaphragmatic breathing, or what kind of ways do you talk about strengthening that area?
Yeah. So diaphragmatic breathing is the foundational, and I'm sure every single pelvic floor PT would say the same thing. It is where you start with connecting to that pelvic floor and deep core. And that's where you have to start in order to tap into those muscles and make them stronger. So diaphragmatic breathing to start with, but then you want to add load to that. So you want to strengthen those muscles by adding resistance. So that can be in different positions you put your body in. It can be with resistance bands, anything like that. But working the deep core in that kind of way with that diaphragmatic breath is huge. And then you transition that into functional activities. So bending down to pick up a box or getting in and out of the car. We use that breath to strengthen our muscles to do that motion to help prevent more of that DR.
Okay, that makes sense. The other thing that threw me off is you said 99.9% of women will experience this. It's like blowing my mind. Tell me more about this.
Yes. So I wouldn't say that's like the exact statistic, but pretty much all women going past week 35 of pregnancy will experience a DR postpartum. Now, some women, there is a case where you don't really know you have a DR because you've never checked it. And then it does kind of just go back on its own because you do just have that breathing technique naturally, maybe. But I would say most people have to work at it in order to heal that diastasis. So, yes, it pretty much, I mean, every single woman I have seen postpartum from pregnancy has had a DR.
Even in like a minimal amount.
Exactly.
Okay.
Yes.
That's super interesting. That was like,
yes.
Don't say that.
Yes. Yeah. But it shouldn't be, I don't want that to be a scary thing because it is absolutely something that you can work on with consistency and a little bit of effort.
You know, I think that's really important to say because I have had doula clients of my own who have gone to their 6-week appointment with an OBGYN or some provider that they've had. And they have been told that there's no way to heal it. Maybe they have a 4-finger gap. You can't heal it. It's probably going to be surgery a little bit down the road, whatever. And I'm like, wait a second. There is so much work. Yes. So even with really big gaps, we just take a moment and talk about that. Like how long, maybe let me ask it like this. After a mom gives birth, about how long for a mom who has a very minor or would never knew that she had a DR, how long does that take to heal? What's like a natural amount of time does that take to heal on its own? Maybe without doing nothing, you know, versus somebody that has a rather large gap, 4 or 5 finger, like a really massive gap. And are they able to heal it? How long do you think that would take ish? Because I know we're talking all kinds of different body types and stuff. And does it ever need surgery?
Yeah. So this is such a loaded question. Sorry. And of course, one that I get. No, it's good. This is great that we're addressing this. It is, I mean, a super common question that I get too. So let's start with, if you have a very small diastasis, how long would that take to heal postpartum? So say you have maybe just like 1, 1.5, 2 fingers. That's a rather small DR. So how long would that take to heal? Of course, everyone is different. However, if you do nothing at all, some people may just have that breath innately and it heals within a couple of months. Other people, it will remain that 1.5 to 2 finger gap. And you have to do something like diaphragmatic breathing to help that gap heal. And I actually just did a post on this showing the research study that most women will have to do something and put in a little effort to heal your DR. It won't just go away on its own.
That's so interesting.
So that was very interesting. Yeah. Yes. But like I said, it doesn't have to be crazy core work or anything like that. It's just consistency and a little bit of effort. So that's with a small gap. Now, if you have like a 4-5 finger gap that you're like, no way is this going to heal. They said surgery is the only way. I'm here to say you can still heal your DR. It will take time. It will take effort, but you can heal it. There are some cases where, yes, maybe surgery is the option, but even if surgery is the option, you still want to do that work beforehand to heal your core. And so after surgery, you can still work that core strength and that healing. So as far as timeline for that 4-5 finger gap, you're looking at months and months, not just weeks and weeks. So I think that's a good thing for people to understand, because it's really easy to give up on that. Seeing that you're not getting results immediately or even within a couple months, give yourself 9 months, give yourself even a year to really heal that DR, especially if it is that 4 or 5 finger gap. So, and that's not necessarily doing like core exercises every single day or the breathing every single day, but it's consistently working on it 3 times a week, maybe 4 times a week for that period of time.
Yeah, that's great. I love that.
Yeah. Yes.
All right. Wait, will you take a moment to talk to us about, because I don't know what it is, but what is Mercier therapy?
Okay. So Mercier therapy, the first time I heard about this treatment was actually on an Instagram Live. So it's something that is becoming more well known, but it is a holistic and hands-on approach to fertility issues. And what it looks like is you're working with our hands deep into the uterus, the ovaries, in the abdomen, and then surrounding tissue. So into the glutes, low back, all that fascia that is there connects to our reproductive organs, right? So we want to work that whole area to address the root issues. So essentially we're working to improve the blood flow to those organs, improve circulation, and improve mobility, because if the organs aren't moving properly or optimally, then they're slowly losing their life, right? So this is a way that we can really work on issues such as endometriosis, PCOS, unexplained infertility. And it's something that I have just fallen in love with. So it's awesome.
And this is something you do in your practice currently then?
Correct. Yes.
Do you have, what has it been like working with women that, like, explain some of the women that have come to you and the experiences that they've had?
Yeah. So let me just give you a few examples. So let's take one of my clients. She had done 4 rounds of IUI and had no success. And they had been trying for a couple of years. And so she found Mercier therapy through just a Google search of looking for holistic approaches. And so she started working with me, and it's a 6-session protocol. So we do a session a week for 6 weeks. And then we also talk about different external factors, mental, spiritual, emotional, all of that gets put into the treatment that we do. And she, after our 6 sessions, she got pregnant. I think it was 2 months later. And with her, this is pretty crazy. She actually got pregnant with twins, and twins don't run in her family or anything like that. But she was just completely shocked.
Too good.
Exactly. Yeah. And that's not like a side effect of Mercier or anything like that. Awesome. It's just how it happened. But yeah, I see clients they've done all the medicated cycles and are just looking for something else, something that's getting more to the root of the issue. And I also have clients who want to do this prior to IVF or IUI to see if this can kind of get them there, or maybe even in conjunction with it as well.
That's so interesting. I remember somebody talking about, it wasn't a pelvic floor therapy, but it was something very similar. Like, they went in through the abdomen and like did manual manipulation of different things in there. And I can't remember. It was like a specific massage or something. It sounds very similar to what you do. But it had been brought up to me because same thing, like we have secondary, unexplained secondary infertility. So all 3 of my boys, like we thought about it. We were pregnant first try, or at least like first month, like immediate. And then we took a 3-year gap, and then I was like, okay, I can breathe. Like, let's do this again. And I mean, for 4.5 years of tracking my ovulation, my menstrual cycle, temping, we went and we were tested. We talked about doing IUI. I decided against it, but my husband was tested. Like, we did all the things. And I'm like, this is really weird. And I have endometriosis. And so I went and saw a specialist for that. And I had surgery for that with a specialist. And then we tried again and we still didn't get pregnant. And it's so interesting because when they go in for like endometriosis, for example, you're talking about all these different organs that are connected or muscles and stuff that flow through those different areas. I mean, endometriosis is something that's like scar tissue that like pulls it all together, right? Like connects everything in a really terrible manner. And so it totally makes sense to me that like by adding mobility and like, loosening these areas or I don't know, stimulating them even could have those effects.
Exactly. And stimulating the ovaries too. Like, I'll kind of talk about my personal connection to it, but when we work on the ovaries, that helps to connect to the brain and signal those hormones to be released and things to kind of get going too. There can be such a huge disconnect. And for people who are struggling with fertility, it is such not just a physical thing, but emotional, spirit, the whole gamut. And so when we have that trauma, or we have those emotional connections to it, sometimes we can hold that trauma in our pelvis or in those organs. And so when we put our hands on them and when we address those issues, we're not just releasing those restrictions physically, but we're talking about the other components that go with it too. So I think that's a huge aspect of it. And some of my sessions do become more therapy. And I mean, I love it. I love it. And there's such a healing component to talking things out and just being heard. So I had found Mercier therapy through my own struggles, and we had been trying for a couple of years and did 4 rounds of IUI, and our next step was IVF. And I just felt in my gut that was not it for us. I just was not ready for that. And so through that whole time, I had been doing functional medicine things, diving deeper into that, acupuncture, so many things to work on my health. And that's when I stumbled across Mercier therapy. And so I had found that in August, and October, I got waitlisted for the course, ended up getting in. So I was super excited to go and not only learn for being able to help other people, but also like, hey, maybe this will help me get pregnant. And so I started to do some of the work on myself that I just knew from my physical therapy background without being fully trained and just knowing what kind of Mercier therapy was. And I ended up getting pregnant the month before I went after doing that work on myself. So it's just so wild. I had gone those 2 years through those medicated cycles and IUI, and it just, it's a pretty... Insane.
That's huge. I love that.
I know.
So I love what you're talking about too. Like that connection, like I wouldn't have thought of that at all. But even the like human connection between somebody touching your body, even from the outside, to like stimulate ovaries or things like that, or like give that information to the brain versus where we get a lot of the medicalized things where it's like, let's stick a wand up there or, add some radiation with some ultrasound on it. Like it's a different stimulation, or medications, or we stopped at the IVF too for the same reason. Cause it's like, that was a point where I'm like, oh, I had even taken some of the like fertility medication while we tried to, increase the amount of eggs or whatever we were doing. But the hormone changes and the like, it can be a lot on a body. And I couldn't decide if that was what I wanted,
Yeah. Well, and not only that, but the financial cost of it too is crazy. And when you look at the statistics, I mean, I think it's amazing that we have these medicated cycles. We have IVF. I have, a friend too, she has no tubes. So there's no way she could get pregnant unless it was IVF. So I think it's a really amazing thing that we have, but I think we do tend to jump to it rather quickly without maybe addressing some of the root issues that are going on. Like for me, I did have a thin uterine lining and I could never get that to beef up. So through doing some of the work on myself and acupuncture, I really was addressing those root issues. So I think there's something to say about just at least working on your body prior to, or maybe at least going into those medicated cycles.
Yeah, no, I think that's great. I think it's a great option. It's a lot less invasive and crazy too.
Yes, for sure. Yes.
That's good. Okay. For pregnant moms that are listening today, do you have some like really tangible tactical things that they could be doing right now to prepare that area? Or you mentioned like some of the strength training and stuff, but I'm even thinking of when I'm with a mom and we're talking about contractions and things, like either as a doula or in the birth course, there is like even the way that we breathe and how we either hold tension there or allow it to be free. What are some really easy things that moms can think about and physically do right now to be really prepared, or even maybe just one thing that they could really focus on, for the next couple weeks to get that prepared for birth?
Yes. Okay. So this is another loaded topic. I'm going to try to be concise with it.
That's why I said one. It's okay. Just do one.
Okay. Yes. I'll do one of the biggest ones. Okay. So I would say even at like week 36, or maybe you already are at week 38 or whatever, but later during that third trimester, if we can work on mental and physical attachment to that breath work, that is huge.
Yes.
So what I mean by that is, pick a couple of positions that feel really good to you. Maybe that's an assisted deep squat. So you're holding on to, a chair or the leg of your table and squatting down into a deep squat. Maybe it's child's pose or whatever position it is for you that you can kind of get into a relaxed state, and working on deep diaphragmatic breathing, relaxing your pelvic floor. And the reason we want to relax our pelvic floor is because as we go through those surges or those contractions, and as we give birth, we want those pelvic floor muscles to open and relax and allow our body to do its thing so baby can enter the world, right?
Yep.
So when we practice this ahead of time, it's just like any other event in our life. We want to prepare our bodies for it, like a marathon. If you just go straight into a marathon, sure, maybe we'll be able to finish it, but it's not going to be great maybe, or you're not going to do it as optimally as you wanted to. So if we can prepare even just a few weeks ahead of time, that's great. So finding those positions, doing those breathwork patterns, which let's talk about that real quick. So the breathwork I'm talking about is deep diaphragmatic breathing, relaxing the pelvic floor. And I like to tell people to do a 1-to-2 ratio. So that means you're breathing in for 4 seconds and out for 8 seconds, or in for 3, out for 6. And what you're trying to think about is when you inhale for those 4 seconds, you're trying to just expand your belly. Think about those pelvic floors opening like a flower. And then as you exhale, just passively letting it out for those full 8 seconds. And when you think about a contraction or a surge, I like to visualize a wave. It will grow in intensity and then it will start to decrease. And so if you do 4 rounds of those breaths, so the 4 seconds in, 8 seconds out, focusing on that breath, it will really get you through those surges.
Yeah.
Which is awesome.
That's perfect. I couldn't have said that better myself. Like even when we teach, within the birth course or whatever, and we talk about breathing, it's blowing it up like a balloon and using that breath to get you through contraction. So everything that you said was great. My problem and what I was doing and what I find a lot of like athletes or women who are very athletic, or women who strength train but do the heavier stuff, we naturally hold tension in that area. And so I was trying to fill my belly and stuff, but I was still holding tight in my pelvic area. And I think that's such an important, once you get that connection, like when I'm breathing in, that area is pushing out and down, and like I would have to physically say those things to myself so that I was connecting the two. And then because it's a learned thing, it is not like some people naturally do it. Most of us don't. And so once you get that connection though, it's like, oh, muscle memory, I can do this all day long. And
exactly. That is the key right there. Yes. That muscle memory, you're just training your brain and your body to go to that breath as your help through the whole process. And another thing to keep in mind is as you're practicing that breath, maybe you say some of those affirmations to yourself, like, my body is ready for this. I'm capable of this. I'm strong. My baby is strong. Different affirmations. I had a whole playlist that I would listen to as I was working those breathwork things, preparing for labor. So that's something when you're in the moment, you can put on that playlist or kind of refer back to those affirmations if you feel like you can to help you get through those breaths. And then the other thing too is take note of what your body is doing. So just like you mentioned, are we holding tension in our hands? Are we fisting up? Are we clenching our jaw? So as you're working those breaths, let your jaw relax, let your fists relax, grab onto a comb and hold onto that comb so you're not squeezing it super tightly. So many different things that we can utilize to help our bodies kind of get into that more relaxed state as we're going through that.
Yeah, that makes sense. And I love it. Okay, take a moment. Tell us a little about the PDF that you have for everybody listening today. And then I want to give you an opportunity to tell everybody where to find you. In fact, which state are you in right now?
I am in Kansas City.
Okay.
Yeah.
That's so fun. Okay.
Yes. Okay. So the PDFs I gave you a couple, so you can use whatever you want, but I have a tight pelvic floor PDF, and this one just walks you through kind of what a tight pelvic floor is, a few reasons why that might be an issue for you, and then exercises you can do to help improve that. So you can take that, start practicing it, and it's pretty amazing how when you just implement a few exercises and what I've said this whole entire podcast, be consistent with it and just continue with it, you can make a pretty big difference. So I have that one for you. And then I also have a strengthening your pelvic floor one as well. And it walks you through how to do full body strengthening, not just those Kegels that everyone seems to talk about. And then I think I do have one more that I gave you, which is just some exercises you can do early postpartum and checking for a diastasis. So just a few tips to kind of get you started, or at least get your wheels turning on where to turn for that kind of stuff.
Awesome. Thank you. I'm excited to be able to hand those to the audience. They're going to love it.
Yes.
Okay.
Yay.
So if people want to connect with you, how can they do that? Where can they find you?
Of course. So I have an IG page. It's at Doc Lizzie DPT, and I have tons of information on there. And they can also reach me on my website, which is www.doclizzie.com.
Awesome. And just to spell that real quick, it's DOCLIZZIE, right?
Correct. Yep.
Okay.
You got it.
Perfect. So you guys go connect with her there. And thank you so much for your time. This was awesome.
Yes. Well, thank you so much for having me. It was awesome.
That's it for this week, but make sure you subscribe to the podcast so that you get notifications first as I drop a new episode every week. And don't forget to head over to myessentialbirth.com for all of the free downloads mentioned here and to join the birth course and community serving pregnant moms just like you. If you enjoyed this and other episodes, I would love it if you would take a few minutes to leave a review on Apple Podcasts. I read every single one and include one at the beginning of each episode. See you next week.